Hello, everyone, and thank you for your interest on our poster on the interaction of contextual factors and implementation strategies in the reduction of under-5 mortality. It is my pleasure to be presenting this poster on behalf of my co-authors listed here. So to give a bit of a background, we know that in the past few decades, especially between 2000 and 2015, which is the timeline of the Millennium Development Goals, we saw significant reductions of under-5 mortality across the globe. However, we also know that there was disparities in this success, right? So some countries were able to implement the known evidence-based interventions to reduce under-5 mortality, while others were not as successful. So within the study, we identified 6 exemplar countries that outperformed their regional and economic peers in reducing under-5 mortality between 2000 and 2015. In order to understand how they achieved this success, we used a mixed methods implementation science approach driven by a hybrid framework and a theory of change that you can see here under the background section. So these countries were Bangladesh, Ethiopia, Nepal, Peru, Rwanda, and Senegal. And as you can see from the theory of change framework here, among other aspects, we identified that contextual factors were important in the reduction of under-5 mortality, and that there were 4 levels: global, national or subnational, Ministry of Health or health systems, and community or individual level contextual factors. So within our study from these 6 countries, we understood that the exemplar countries were able to leverage the interaction between contextual factors and implementation strategies in order to reduce under-5 mortality. So to give you an example here, for instance, if we look at the national or subnational level, countries that had an existing national priority for health, including under-5 mortality, were able to leverage that contextual factor and select strategies that would leverage that contextual factor. So given that a sustained commitment to health allows for accountable EBI implementation, countries selected, for instance, multi-sectoral approach to bring together all sectors to work towards reducing under-5 mortality. And from our study, all 6 countries identified this as a facilitating contextual factor. However, in countries, for instance, in Bangladesh, where culture and beliefs were considered a barrier, they selected implementation strategies such as community education and community engagement to address this contextual factor. So these countries' ability to use context-informed implementation strategies allowed them to achieve various targeted implementation outcomes such as acceptability, reach, and sustainability. And ultimately, it contributed to their rates of under-5 mortality reduction. So as the major conclusion, one of the main conclusions from the study was that for countries to reduce under-5 mortality, it is important that they understand their local, the global contextual factors and adapt their implementation strategies, the choice, the design, and the execution of the implementation strategies to these contextual factors. And by doing so, will they be able to achieve high rates of success in reducing under-5 mortality? Thank you for your interest, and please feel free to contact us if you have any more questions.